board. So.
Great. Well, thank you so much, Sonia. Thank you for attending the talk I gave a few weeks, well, it's probably about a month, 6 weeks ago now, and kind of nabbing me during the lunch break. It was great to catch up. We'd actually known each other, not since medical school, but from medical school. You were a couple of years ahead, and it was great to see you after all these years. And yeah, so I'm a consultant psychiatrist, and I one moment. So I studied and trained as a forensic psychiatrist in East London NHS Trust. So that was pretty much my my single focused goal as a trainee coming through London, graduating from GKT. I developed an interest in medical education and teaching. So probably about halfway through my higher training, I went part-time in my training program in order to do a clinical lecturer role at Bart's Medical School. And I kind of carried that on all the way up to the time that I left the NHS, which was about 2.5 years ago now. So going from a consultant forensic psychiatrist, having an outpatient caseload, to really having my own outpatient caseload as an independent practitioner, private doctor. I have my own clinic now in East London, in Canary Wharf, and I see patients for a whole range of mental health problems, including ADHD, which is something that has become a lot more on my radar over the last few years. And I think I've developed a bit of a expertise in it just because of the volume of patients that I see. So that was ADHD was, it kind of came up after the talk between this discussion with Sonia and myself. The talk at the IPM was really around my approach to trying to overcome mental health problems, which is slightly a different take on the conventional medication and psychotherapy, which we're all kind of trained with, and we can go into a bit of detail on that as well. But today really is trying to focus on ADHD, and I was really really interested by the interest from doctors, in particular general practitioners, when it comes to ADHD, because I think the solution to the problem is less, I think, in the hands of or the lap of psychiatrists, and more so primary care and GPs in particular. So having an interested group of general practitioners, I think, is is a great opportunity to find out about the change in the landscape, because of my discussion with Sonia, I think there's certainly a lot more scope for primary care to try and develop services when it comes to ADHD. So today I don't have a structured presentation as such. I can talk a bit about ADHD, but really the poster was having kind of a Q&A, and answering any questions that individuals have around maybe what ADHD is, the challenges of ADHD, the challenges they face with the patients that they see. So I really want it to be an interactive session. So do feel free to put anything in the chat, any questions that you might have, any thoughts, and we can pick up on the themes. It's really supposed to be, I think, an interactive session rather than me talking at you for the remaining 50 minutes or so. So please please do type something in. I'm not sure, Sonia, whether people have kind of sent questions or themes or things that they wanted me to focus on today.
So Ali, I think what might be really helpful is that if you could give like a 5-minute overview of ADHD and why I think it's so important, so relevant. So it gives us a starting point, and that will get people's
Sure.
emotional and creative energies flowing.
Yeah, wonderful. Yeah, for sure. So ADHD used to be considered a problem just with children. So we have this stereotypical naughty, aggressive, hyperactive boy who just is out of control, temper tantrums, oppositional, defiant behaviors, and just very disruptive, not only at home, but also at school, getting in fights, getting expelled, suspended, and really not having a great life trajectory, and more likely to end up in prison than they are in a university. And I think that's really been the perception of ADHD, that it's this naughty boy syndrome that really is limited to children. And I guess really over the last 10 years or so, we've developed a much more accurate understanding of what ADHD is, and it's not defined to that. That's one subtype of ADHD. It's not limited to children. We are seeing a greater increase in the prevalence of ADHD. So really from about 5% about 20 years ago, 5% of kids, to about 10%. And we know that it for many people goes into adulthood. So we have about 5% of the adult population also suffering from ADHD as well. And there is quite a big difference between male and female presentation. So although the core symptoms, which we'll come on to in a moment, are important and they're present in both men and women, there is a tangible difference in how the symptoms manifest, and the women in particular internalize the behaviors much more. So there's less outward hyperactivity, there's less aggression, there's less kind of defiance in that way. So they're a lot more compliant. Girls generally in school are brighter, so it's easier for them to do better in their exams. And school's that type of environment where if you're passing your exams and doing well, no one really kind of thinks that there's any issues. You don't really go on anyone's radar. So a lot of female ADHD gets overlooked, and there's these perceptions that, oh, you're doing well at school, you're doing well at university, there's no way that that there's anything wrong, let alone ADHD. But in reality, there's a lot of internal distress. There's a lot more effort that's required in order to get the results. Often things are left to last minute, and there's a high level of stress in the day or weeks before exams and assessments and those types of things. So there is that distinction between male and female ADHD, which is certainly valid. And I work with a lot of both. It's primarily adults, men and women. And I must say, from my last 3-4 years of really working in the ADHD space, there is quite a distinct difference between the two. Now, moving on to some of the core features of ADHD, we consider it to be a neurodevelopmental disorder. So the issues and the problems do need to have some origin in childhood. Sometimes it's difficult because people can't remember the childhood very well, or they don't have much kind of information from others, from family members. Parents maybe not alive or estranged, same with siblings. But on the whole, there is often the opportunity to get an account from someone who's related, or someone who knows a person well, and that's really important. Having origins of problems in childhood, and when you're assessing adults, it's always important to recognize that the problems can evolve, and how they present can be very different from childhood to adulthood. And I guess core features that we're looking at is, I guess, in 3 or 4 different categories. So the first category is just really not being able to get stuff done. So these are my own categories that I've kind of developed because I think they're a bit more meaningful than just going through the DSM criteria, which is really what I use for a formal diagnosis. But they're really not getting stuff done, and that can be for a number of reasons. But predominantly not being able to focus enough on tasks to get them done, not being able to shift from one task to another to get them done. Often there's a bit of a confusion around the lack of focus in ADHD, where it's not actually a global inability to focus on anything. People with ADHD can really hyper focus on particular things that they find really interesting and stimulating. So some people, their studies, for example, other people, their hobbies, but it's really limited to 1 or 2 kind of categories. On the whole, if we look at other aspects of their life, things are falling apart, even though they may be performing really well in one aspect of their life. So they do have a tendency of hyper focusing, but on the whole, difficulty in shifting attention and focusing on things in a global sense. So professionally, things might be really good, but if you look at someone's personal life, their home's a mess, their room's a mess, the relationships are disastrous. So yes, so not being able to get stuff done due to the lack of focus, attention, concentration, and shifting between tasks. So that's one area. The other area is this kind of hyperactivity. So it could be a physical hyperactivity where someone can't sit still, and that can be quite extreme, where someone literally can't sit still for longer than a few minutes. Often people describe when they're at school that they have to make an excuse to go to the toilet in order to be able to exert some energy. They just find it really difficult to sit in one space at a time. That irritability that comes with that hyperactivity can manifest in being quite disruptive at school, in class, talking to others, being told off continuously. But there's also an inner aspect of that hyperactivity where the brain really just doesn't shut down. And pretty much everyone with ADHD talks about it in this way, that there's multiple threads of dialogue going in the brain at any one time. It's very different to something like an auditory hallucination, for example, or pseudo hallucination. It's parallel streams of their own consciousness, and it just doesn't stop, and it carries on until the whole day, until bed. People with ADHD often struggle to get to sleep because they just can't switch off. So this is hyperactivity which manifests both physically and kind of emotionally and internally as well. The third category is really the impact upon mood and anxiety. Pretty much everyone that I see with ADHD has high level of anxiety, have high levels of either mood fluctuations or depression, I would say, and pretty much everyone has very low self-esteem. And so it's something that can be misdiagnosed often. I guess most adults with ADHD, the ISS, have been on antidepressants because they've been diagnosed with anxiety and or depression in the past. But these kind of emotional and mood anxiety features are really key when it comes to ADHD also. They're probably the main categories that I generally see. The others, the other kind of criteria does fluctuate, but I think what's consistent are these three main areas. Yeah, so I might just pause there for a moment. If anyone's got any kind of questions on those, you can ask, but I think that we've got some things in the comments.
So I was just going to pick up. Oh, sorry, 1 second. Just lost the screen. Ah, thank you, husband. So yeah, so thank you for that. That's really helpful, because obviously I think a lot of us can identify with that. I think, as you said, there's a difference between the adults and the kiddies. And I think I work in the adult space, I work in a primary care mental health service, within a GP role. So it's a broad picture. But I think that some of the stuff that we see, as you say, it's one area of their life might be working beautifully, and that's often professional, because it's structured, it's organized, it's predictable, and it's controlled, and it doesn't have multiple variables. But the other areas, the mental health, the family, the relationships, those things are really quite heavily compromised. And I think that the reason this is important is because there are strategies that you've got to talk about that can help people, because sometimes if it's undiagnosed, untreated, it can be associated, I think, from what I picked up, sometimes domestic violence. When people, I had someone yesterday who I was speaking to, and she said that she really struggled to keep a cool with her husband, and she had a 16-month-old baby, and she said that when she's out at work, she's fine, she concentrates, she gets on with it. But when she's with people that she trusts, she feels angry, irritable, frustrated. Her words were that my thoughts go at 100 miles an hour. It was very classic, and nobody had ever spoken about ADHD. My thoughts get 100 miles an hour. Is very bright, but she failed a couple of exams. You know, there was all of that, and the fatigue was phenomenal because obviously she's trying so hard to hold it all together. But it got to a point where she chucked cling film at her husband, and so a safeguarding. I mean, we had to put in a safeguarding. So it is really, really tricky because, you know, you wouldn't know looking at her, speaking to her. But she's obviously somebody who's got to a point where her husband has said, look, and luckily it's a supportive husband. He said, look, you know, my father was really abusive. I think you need to go and get some help. And it was fascinating for me because she said when he tries to set boundaries or shut down the conversation or say, I need time out, it makes her even more angry. So she tends to escalate. So you know, my point is that there's a lot that can be done to help people, irrespective of medication. And what I was hoping for, I mean, there are some questions on the chat, but I was wondering perhaps if you could give us your take on what you think about medication, adults and teens and kiddies, and also what other sort of strategies you think there are. And then perhaps we'll pull the questions off the
Yeah,
list because I think
sure.
that'd be a good starting point.
Sure. And I just want to say a couple of points on the vignette that you gave. Uh, yeah, it's that kind of structure. So in general, the less structure people have with undiagnosed ADHD, undiagnosed, untreated ADHD over the course of their life, the more likely they are to decompensate. And so sometimes just school is too much for people. But often I find school in their self-reports has been quite a safe environment, but it's so structured. But when they get to college, some people really fall off the wayside. And some people are okay at college. When they get to university, they off the way. Sometimes university is fine. When they go to postgrad, masters, it gets too much. So the structure is key. When we're looking at kind of markers, you know, how well does someone function in an unstructured environment? And really their intelligence has got nothing to do with it at all. And I've met people with ADHD just in the last month, from prisoners with ADHD to professors. I've a couple of professors on my caseload at the moment. So it has nothing to do with intelligence or IQ at all. And just a final thing on the case vignette about aggression. I think it's that irritability is often related to another core feature of ADHD, which is impulsivity, and that manifests in a few different common ways. So one can be aggression and arguments and just being angry and kind of venting. A lot more commonly, it's food. So lack of control around food. So I think most people with ADHD that I see, especially most women in particular, impulse eat, and that's I think a big telltale sign. And yes, so I think it's really important to be able to I guess understand the umbrella of how ADHD can manifest, but impulsivity is a big aspect of that, and that manifests in lots of different ways, and it's another core area that I see over and over again. Okay, so moving on to the question about medication. So it's really interesting because I would say that there's just two polar ways of looking at it, and both can coexist, and both do coexist in the way that I try and work. As far as all of the possible psychotropic medications out there, I would say that the stimulant medications for ADHD are probably some of the most effective out there, in the sense of they actually work. So it's a psychotropic medication that you give to a patient with ADHD that pretty much, I would say, 8 times out of 10, someone's going to have a pretty good response to it. And that really blows antidepressants, anxiolytics, antipsychotics, most other categories of psychotropic medication out of the water. They're really effective, and they don't take weeks to work. So often it's within days. When someone starts the medication, they can notice things pretty much immediately. Sometimes you need to titrate to a medium or a higher dose to see that effect, but more often than not, you see within a few days the medication can potentially be life-changing. And that's, you know, it's difficult for me to say that about any other psychotropic medication. So that's a real big plus, that most people will benefit from the medication. Most people also tolerate the medication pretty well. There are transient side effects, so most commonly headache, dry mouth, heightened anxiety for a few days or 3 hours from taking the first medication to a few days. Increase in, reduction in appetites, reduction in sleep, and increased blood pressure and pulse, which occurs in about 20% of people. But that's something that I always have to monitor when I'm on a titration for anyone starting the medication for the first time. So they are really effective, and they are generally well tolerated. So that's a real plus side to it. However, there are no long-term safety studies beyond, I think, 18 months maximum, but I've pretty much most of the studies that I've seen are about up to a year. So what the studies show is that they're really safe for about a year. But like with all medication, they don't actually address the underlying root causes. So if someone stops medication, it's pretty much guaranteed that they'll end up back at square one where they were before the medication. So because of that, people are often on medication for years, but the risks are, I think, real and unknown. If we look at both real and unknown in the sense of there's no studies, but if we look at something like methamphetamine, which is a recreational drug, which is very, very similar to dexamphetamine, which is Elvance, it's pretty much the same thing. But there are lots of concerns around cardiac issues. There are lots of concerns around brain health, risk of dementia, over long-term use of amphetamine-based recreational drugs. So I think the risks are real. So I always kind of make that clear to my patients that I think, from my perspective, it's a relatively short-term approach, whether that's months or a couple of years. It's not something that I want them to be on for 3, 4, 5, 10 years down the line. So what's the alternative? So a big part of my practice is offering, I think that's the best way to phrase it, is offering patients alternative approaches to medication. So things that they can do alongside medication in parallel or instead of, because some people just don't want to be on the drugs. Other people just can't tolerate the drugs. I would say about 20% of people can't tolerate the stimulant medication. And so we have to find credible alternatives. And something that blew my mind a few years ago, I read a book called The Better Brain. And it was written by Julia Ruckledge and Bonnie Kaplan, who are two researchers from New Zealand. And they were looking at the use of micronutrients, so effectively multivitamins in the treatment of mental health problems, kind of the whole range of mental health problems. And it really blew my mind because it showed actual data that I hadn't ever seen before, not to say that I'd ever looked for the power of nutrients before that, really. Depression, anxiety, PTSD, psychosis, and ADHD, amongst others. And I was kind of blown away because I was developing my practice, and ADHD was becoming more of a prevalent thing. And I thought, gosh, I need to try these nutrients, and I need to get the exact ones that were used in the research. So thankfully, there was one place in the UK that was supplying these nutrients made by Hardy's Nutritionals, which is a Canadian company. I've been going for about 30 odd years. And so I started to use them with my as many patients that would kind of have the time to hear me out about nutrients, and of course pay for them because they're not free and they're not as cheap as the ones that you get from Boots. So what I kept seeing over and over again was, after 2-3 months of people being on the nutrients, mood was stabilizing, anxiety was reducing. With ADHD in particular, I had a few patients that saw me for an initial assessment. I gave my initial recommendations, which included the nutrient therapy, the nutrients, and they emailed me between 3 to 4 months afterwards, saying that they'd just done really well and their symptoms were much reduced and they were feeling much happier and just getting on with life. And that was just on the nutrients. And it really kind of blew me away. One thing, seeing something in theory and then another thing in practice. And really, it's formed a big part of my clinical practice, and it's really been an area that I'm a lot more focused on the power of nutrition, not only as a well-being preventative aspect, but actually as a curative treatment for mental health problems, including ADHD. So that's my kind of summary on that. I don't know if there's any questions on that. When you want to come back, Sanya, before we look at what people
no, that's brilliant. And there's a lot of people also interested in coaching, CBT, and exercise. So there's the whole package, isn't there? Rather than just
yeah. I think it's a short, medium, long-term strategy. It has to be thought of it in that way. I very much think medication can be part of that short-term strategy, because people are suffering. That's another marker for ADHD. If someone comes in and says, I've got ADHD and I think it's my superpower, they definitely don't have ADHD, because the D in the ADHD is disorder, and people are suffering. So people on the surface might be leading enviable lives, shall we say, but they're really suffering deep inside. And that's very tangible, and that's also a key part of kind of diagnosis. Yeah, so people are struggling, and that is something that the medication can help with, in order for you to do all the other stuff. Because like with any lifestyle intervention, it takes energy, it takes effort, it takes organization, all the things that people with ADHD are struggling with in the first place. I think coaching is really helpful, but alone is probably not as powerful. So if we're not doing anything to invest in the brain health, and that's really where the nutrients come in. Any psychiatric problem, ADHD is a brain health problem. We're dealing with the brain. It's not about moral compass. It's not about the psyche as such. It's the brain. It's a physical brain and the psychological aspect of the brain, and the work hand in hand. If you can invest in improving someone's brain health, then there's no reason to think why whatever symptoms they're going through won't improve. And that's what I'm seeing in my clinical practice. So the more someone can invest in their brain health, through exercise. Exercise is key. I think some people come in and they have ADHD, and I find that they're doing kind of these extreme sports, but for no particular reason. They're not competitive. Like, I've got this one lady at the moment, and she does Ironman competitions, which are just bonkers. It's such a test of endurance, and she does like 2 or 3 a year, and she's not competitive. But there's something in her that drives her to do it, and it's this kind of extremeness that actually helps with the ADHD, and that often is an interesting sign as well in some people, and I've seen that in certain people. But exercise in general is really helpful, but it has to be part of an overall approach. Exercise by itself is not going to get rid of someone's ADHD. Coaching by itself is not really. I think coaching, the connotations of coaching, although helpful, it can be like, we just have to manage this. Like, whatever you got, we just got to manage it, because we can't do anything more. And I think if it's part of a bigger package, then it can be really effective in that way. Yeah.
So I see quite a few doctors, they go and run triathlons actually. And it makes you wonder, it is, that they're quite driven to do it, which is wonderful. And a lot of people, doctors particularly, use exercise as a form of stress management. But you do see an overrepresentation of ADHD amongst our professional peers as well. I was just going to say, before we move on to the questions, as you know, Ali, that there's an overlap between the different forms of neurodiversity, so autism, and also the other mental health conditions such as bipolar, for example, which is sometimes on the differential diagnosis. And with the approach that you're suggesting, particularly the targeted micronutrients or the lifestyle changes, I'm just wondering whether that, if somebody's clocked up a couple of diagnoses, do we look at them as that neurodiverse individual, or do we look at them as somebody with ADHD who's going to benefit from a targeted strategy? And would that work? Would that give them an overall sort of global improvement in function and mental health?
Yeah, so it's a great question. I think I don't think people generally have more than that. It's difficult to have more than two diagnoses. I think maximum, because most diagnostic criteria lays out that you can give a diagnosis um, uh, if there's no other possible explanation for it. So when you start having 3, 4 diagnoses, I think it's very difficult to be able to justify them existing kind of in a discrete way. Um, so so whether someone has one diagnosis, whether it's neurodiversity or whether they have a combination of diagnoses, um, I think taking this approach to improving brain health is fundamental. So although it is a personalized approach, there are fundamentals that I think everyone should be doing. And part of that is having a nutrient regime to be able to invest in the physiological functioning of the brain health. So you have a broad spectrum micronutrients, and there's a particular one that I use that we can talk about. High dose omega-3s, often in cod liver oil, and a probiotic, which has been shown to help global mental health outcomes, used over a few months to a longer term. And having those three areas, having those three types of supplements together, I think is a foundation that everyone needs to do. And I take those things myself. I take it in the sense of preventative, trying to invest in my brain health, trying to keep my brain healthy. If you're struggling, if you have neurodiverse issues, if you have other more general mental health problems, it's the same thing. When you invest in the brain, it kind of knows what to do in order to help it overcome problems. And it sounds a very simplistic explanation, but I think it's the most effective, because the brain is, without doubt, the most complex thing that we know about. It's the most complex thing in the universe. And we know very little about it. And what we get taught in medical school is this idea of scientific reductionism, that actually we can pinpoint things down to certain pathways. And often those certain pathways are identified by association, and often the research is a bit sketchy, and it's just ideas that get passed down from generation to generation. So we kind of, I think it's a hubris that we can identify very specific pathways in the brain to account for very specific mental health problems. It's the same with genetics. I think that's over-egged. Yes, there are genetic risks for sure, but there's no gene that gives you ADHD, just as though there's no gene that gives you cancer. You can have genes that give you increased risk, but in terms of causative factors, we're too quick to try and find easy, simple, reductionist answers. But the reality is that it's a lot more complex than that. And I think with the brain, if we know what the brain needs, so it needs nutrients. Why does it need nutrients? Nutrients work as cofactors to help enzymes in the metabolism of the brain and the rest of the body. It needs omega-3 fatty acids because that's the 70% of the dry mass of the brain is made from omega-3 fatty acids. So in terms of maintaining good brain health, regeneration, replenishing, you need a good steady source of good quality high fats. Probiotics are really important because they focus on the gut, and the gut-brain axis is something that we're not taught in medical school, but it's the single most important axis when it comes to brain health. Gut health is the source of all inflammation in the body, effectively. And people with mental health problems, people with ADHD, have neuroinflammation. And the biggest source of that is from the gut. So if you're neglecting gut health, then your brain health is going to suffer. And pretty much, I would say 8 people out of 10 that I diagnose with ADHD report specific GI symptoms from constipation, diarrhea, gas, bloating, abdominal pain. When I ask them, and I always make a point of asking them, about 8 out of 10 have all of those things, often diagnosed with IBS. It's the most common co-diagnosis or dual diagnosis that I see with ADHD. So it is, I think, seeing it as a foundational approach. So what are the foundations of brain health? So we've got the nutrients, we've got the exercise. Diet is key. Cutting out the crap No one needs refined sugar. No one needs to snack. We live much more sedentary lifestyles. If anything, most people don't need 3 meals a day. Most people are fine with 2 meals, but we certainly don't need to snack. We don't need to snack on anything. These are habits that we've got into. No one needs refined sugar. A lot of people are sensitive to gluten, dairy, soy, corn, and having an elimination diet where you just take out all those things. You don't need to do all the IgG testing and all that stuff. The most simplest way is just cut out the foods for 3 to 4 weeks, or 3 weeks, 2, 3 weeks. People, we resensitize to those foods really quickly. So if you take them out for 2, 3 weeks and then put them back in, you can actually see the effects of what types of food groups might be more problematic for you. And I don't know the sensitivity of these IgG, these intolerance tests. I don't know what they mean when they come back with a positive thing. What does that actually mean? So there's more meaningful ways. So as part of the approach, kind of nutrition and diet is important. And often you start off by trimming stuff out before you replace. So you need to be highly motivated. That's the thing. Along with this approach, there's no side effects, right? It's not a drug. There's no side effects, but it takes longer and it takes more effort. But we don't get something for nothing, and that's the real kind of challenge with this. You do need motivated individuals. It doesn't have to be as hard as it can be for some, but that motivation needs to be there.
No, that's absolutely brilliant. Thank you. And we see a lot of, as you say, gut issues across the spectrum of neurodiversities. Be using studies on sort of fecal microbial transplantation, autism, and noticing completely different behavior, at least in mice model. So that's fabulous. I think that I've asked a lot of questions, but there are people that have given up their time to attend. So we probably ought to go through the chat box. There's some brilliant questions on there. Would you like me to read them out and you can fire away, or you feel free to kind of read?
That might be a bit more natural than me talking to
okay.
myself.
So the first one's from Imrana, and I think we've sort of touched on this already, but really interested to know basics of the role of nutrition in the management of ADHD, please. Imrana, are you quite happy that's been covered? So I think Ali's mentioned the importance of cutting out the crap and then, having a whole food diet, looking at what you're reacting to, and then probiotics, omega-3s and micronutrients. And perhaps, Ali, you could send some links perhaps at the end of what sort of things you would recommend, unless you want to add anything to what
so the only thing to add to that is, as a starting point, having a high protein diet. So studies have shown that high protein diet can be as effective as medication, as Ritalin, in terms of helping reduce symptoms. Really, really amazing. But it also helps if someone's on medication to improve the effectiveness of medication. It's kind of an additive effect. Additive, it has its own effect. So when you do it alongside medication, you're going to have much more symptom reduction. So high protein diet and lower refined carbohydrates.
So we're not talking junky protein, the fake, whatever it is, and protein shakes. Yeah, exactly. We're talking quality protein, aren't we? Meat,
quality
fish,
meat,
eggs, cheese, and beans and pulses. Yes.
Yes, absolutely. Yeah.
Brilliant. Okay.
Yeah, it has to be real food.
Real food, thank you. Not the fake stuff, not the powdered processed stuff. Okay. Thank you. This is from Zahra. Thank you for your time. Any ideas for how we can treat patients without medications, behavioral techniques that we can teach parents? So perhaps if you could look at, I think that we've sort of looked at the alternatives, but perhaps if you could touch on behavioral techniques or
so I think when it comes to parents, what I generally recommend, there's a great book by Dr. James Greenblatt called Finally Focused, and it's about 12 quid on Amazon. I'll put the links in. We can send the links out. And that essentially is, he's an American psychiatrist of, I don't know, 40, 50 years. He's old and grey, which is great because there's a lot of information you can get from 40, 50 years of clinical practice. And he works with adults, but it's primarily a child psychiatrist. So he's written this book as a guide for parents to really help your children overcome ADHD without medication through lifestyle changes. And I think if there's specific behavioral techniques are important if there's specific behaviors that you want to address. But I think the biggest behavioral change is around the food and
Mhm.
around people's relationship with food. And when it comes to kids, I think what the studies have shown is that the biggest source of sugar are sugary drinks. So if you're going to cut something out, cut out the sugary drinks, because that's I think about 80% of the sugar intake from kids is from sugary drinks. And actually, if I look back at my childhood, I wouldn't drink water. I didn't drink water. I had like cordial or some juice. I was kind of horrified a few years back when I was thinking about it. I was like, oh gosh. And so I actually had to train myself to enjoy drinking water about 5, 6 years ago. I remember doing that. I was drinking it. I think I don't like the taste of this, but I knew that this was much better for me. So it's that the biggest behavioral changes are the relationship we have with food. And so we're often said, well, it's more implied. It has to smell good. It has to taste good. It's something that satisfies our desires rather than our nutritional needs. And it's really that's I think the biggest behavioral shift. If you can shift people's relationship with food, you're over 50% there. So that's the biggest behavioral intervention
That's
I think is required.
amazing. But I will say is that a lot of these kiddies are quite addicted, aren't they? That especially the sort of neurodiverse ones, they can be more selective, and the
Yeah,
ADHD kiddies addicted to
yeah,
sugar, addicted to screens,
yeah,
they're quite addictive,
yeah,
obsessive personalities.
yeah, yeah. And it's not
Quite
easy.
hard, very
It's
hard.
not easy. It's not easy. So it's that kind of in the short term for parents, it's probably going to be a lot more difficult. A
Yeah.
lot more difficult. And I don't think there's a way to navigate that really. I think you just have to ride it out. And I think parents know their kids best. So in terms of how to approach things, I think to be led by them. But it's really hard. It's really hard, especially we've got autistic kids who are fixed on certain ways of eating. And if it's not possible, then we're not just talking about one thing. Then there's other aspects as well that you can focus on instead, and then get to the food when you can. So it's not about being fixed on one approach that becomes unhealthy if it doesn't work. Because the beauty of this is there's a number of strands, and the more you do, the better you get outcomes generally. But it's not about one specific thing.
But also they may have food sensitivities, mightn't they, particularly if they are in that bracket. I
I
was
think
I
they all
was
do.
reading
Yeah.
something really interesting just a few days ago, and it was talking about the impact of medication long term in terms of affecting the I can't remember, it's not the synaptic, but maybe the lipid structure. There were some structural changes happening in the brain. So it's probably experimental research, but I think if you put that into context, you think you're starting a child with medication pretty early on, in their tweens,
Yeah.
then you have to think about longer term changes, I think, because as you say, we don't have the data, but there is some of this information emerging that it's not without any risk of modification to the brain over
Completely.
time.
Completely. And ultimately, what most drugs do is poison receptors, like stops receptors from working.
Receptors.
Things that, that's effectively what pretty much I think 99% of drugs that do. So when we look at the stimulant medication and the impact on dopamine, you're artificially increasing dopamine levels, and that has a feedback effect. Like everything, it's the homeostatic mechanisms within the whole body are there. We know that basic physiology. So when you increase something, there's a feedback effect, and so you naturally produce less of it. So over time, you're running in deficits in the
Yeah,
short with the
very.
short-term gains, which are really helpful. Long-term, you're not going to survive without the meds if that's the only thing you have, because your body will make less dopamine and you'll need more stimulation. And the screen times, the screen time, we're living in interesting times. I think it's unprecedented. Like we don't really know how these screens affect the neurodevelopment of children. Yeah, it's
No.
nothing good, right? It's nothing good. I wouldn't go as far as to say it causes ADHD, but it certainly doesn't help, right? Um, so yeah, um, it's not being fixed on one thing, but really just being aware. And for parents, it's just that consciousness that actually there's a whole range of things here. Where can we begin? And that's the biggest challenge I have in the type of work that I do. It's not what, it's kind of where do we begin? Because everyone's different and their circumstances are different. I can give people like 20 things to do that I know will work, but if they can't do them, if they can't do one, it's just it's actually counterproductive. It actually causes more harm because they get more depressed and more helpless. And your job is the other. So it's about tailoring the approaches. And I think that's where the personalized part of personalized medicine comes in.
Yeah.
Not necessarily the genetic testing or the nutrient testing, and there's certainly a role in that, but it's about how do you personalize the approach as a starting point.
No, that's brilliant. And it is, as you say, about the right entry point for the person in front of you and not
Yeah,
a blanket approach. With a lot of the lifestyle medicine approach, it is evidence informed, which is
yeah,
informed by the patient in front of you
absolutely.
rather than just evidence based. Next question is any research into genes associated with ADHD? So I think you've sort of mentioned this, but perhaps you could give a bit more information.
Yeah. So maybe I can link the paper. So I was looking this up because we mentioned at the start I have a TikTok account, and whenever I mention that genes are not really such a big deal when it comes to ADHD, I get a lot of backlash. I get a lot of heat. So when I'm feeling particularly mischievous, I do a post on genetics and ADHD. Um, and so I thought, okay, fine, let me see what I can find. So it was about a couple of months ago. So I did just a very basic literature search, and there was a review paper from about 3-4 years ago, so relatively recent, a review paper looking at the genetics of ADHD, and they probably identified about 30 odd genes that were associated with ADHD. They couldn't find any evidence that said certain genes caused ADHD or that most people with ADHD have certain genetic deficiencies. It was actually quite a lot of genes at a point where they said that we can't, it becomes relatively academic, that we can't identify more important genes. It's just a whole range of stuff. And what is very interesting, what they concluded at the end was that actually environment is more important than genes. Um, and so that's really powerful. The environment, we kind of think of the environment outside, yes, like toxicities that we get and screens and things that we learn behaviorally and traumas and things are important. But what's more important, I believe, is the environment within the body. And a big part of that is inflammation, right? There was a study from 2023 looking at, it was in Japan, looking at pregnant women and looking at pregnant women and how many of their children aged 8 developed ADHD. And what they did was they measured inflammatory markers, I think CRP, IL-6 in these mothers. And what they saw was the mothers that had high levels of inflammatory markers were much more likely to have children with ADHD at the age of 8.
Wow.
And the researchers concluded that this wasn't an association, right? This was a direct cause. Right? And that's really powerful. And it really takes something for researchers to go on a limb to say, look, it's a cause, not an association, because that's what we're used to, right? And it wasn't the first study of its kind to have the same link. So there are causes that we're aware of that are more related to the environment within the body rather than kind of genes. And I'm not saying genes are irrelevant. I think genes are important, but not in the way that is, I think, particularly helpful. So yeah, I think when it comes to genes, the thing that we get mixed up is the high level of hereditability, right? So if you have someone with ADHD, they're likely to have at least one parent really that has, or an uncle at a stretch, but someone in their generation above that they know that's very close that has ADHD. They're more likely to have children that are ADHD. So automatically we link hereditability with genes and nothing else. And my understanding is that, there are environmental factors within the body, like inflammatory markers, like microbiome, that can get passed down from parent, often mother. It's difficult because mothers have a hard enough job as it is to take on this extra responsibility in that way, but that gets passed down as well. So it's more than just genes. so it's the environment, external environment. What is there something about the environment that families brought up in, the lifestyle that they share, that puts them at high risk? That's more important than the genes. That contributes, I think, more to the hereditability of ADHD than the genes.
Brilliant. So what I'm hearing is actually it's the impact of the environment influencing gene expression. So the genes may be there, but it's actually how we're living our lives and the external environment, whether that's relationships, whether that's stress, whether that's pollution, God knows what it is, does impact our gene expression, does impact levels of inflammation and our gut health. Just curious, that there've been some speculative studies linking maternal stress in pregnancy with ADHD in children. I guess stress is a driver of inflammation, but I'm extrapolating a bit here. Is that something you're familiar with?
Yeah, I think that that study kind of alluded to that.
Yeah, yeah.
When we're stressed, we get inflamed, and that's a general thing in medicine. So if we're looking at brain development and stress, it's just which organ are we dealing with when it comes to the impact of stress and inflammation. So we're dealing with the brain. We'll talk more about ADHD. If we're dealing with the gut, we talk more about IBS. If we're dealing with the joints, like rheumatoid arthritis, all that inflammation. If we're looking at heart disease, what we understand more about heart disease now is that it's down to inflammation.
It's all systemic, isn't it?
Yeah,
Actually, inflammation doesn't sit in one place and not
yeah.
communicate.
And also, it's really complex. We don't understand inflammation. I remember looking at there was this slide that I did, I think it was a talk last year, just showing inflammation. It was like took the whole slide, and it was just what we think we know, and it's super complex. So it's this idea. I think it's more of a concept,
Yeah.
rather than something that we know more definitively about. But yes.
No, that's brilliant. Thank you. I'm conscious of the time. I know it's 8. Are you happy to stay on for another sort of 15 minutes or so?
Yeah. I've got a meeting at 15:15, so we're happy
We'll
to
be off
go.
for them. Is that
Yeah,
all?
we're happy to
Thank
go
you
all the way
so
up to then if we need to. Yeah.
Okay, lovely. So this is a message from Manisha. I'm in Southwest London, Twickenham, and we have a long waiting time. So I've been requested not to make any referrals for now. So this is a common problem across the sort of spectrum of general practice that several areas have said not to make any referrals because the waiting list is so long. Until the backlog has been cleared. Can you recommend any resources specifically for ADHD that we can direct our patients to whilst they are waiting?
Yeah, I hear that a lot as well from my online work on TikTok. People saying, I'm on a waiting list, and it's just like years. What can I do? And there is a lot you can do. There's a lot you can do. I think 90% of what we've spoken about today is kind of actionable, practical things that people can do. But where do I appreciate you don't have the time in general practice to take out 10-15 minutes to say, yeah, we're gonna focus on this. I think the book that I recommended, so the Finally Focused book, I'm going to put it in the chat. Finally Focused by Dr. James Greenblatt. Is certainly one, but he's got a website as well that he has kind of snippets around that, and it's a practical guide. That's the beauty of it. The other thing is, if we're talking about mental health in more generally, so there's another book, and it's probably something that the doctor should read, really, and then you can kind of give bite-sized stuff to your patients. But patients who are interested, End of Mental Illness by Dr. Daniel Amen. And he's actually a big source of inspiration for me in terms of the way that I work clinically now, in terms of a holistic approach to brain health, helping any and all mental health issues. I think their resources, certainly for ADHD, the Finally Focused is something that everyone with ADHD should get hold of. But I think all the doctors should read both of these books and be able to impart whatever knowledge and advice they can from those. I think that'd certainly be a starting point.
Brilliant, thank you.
Oh, sorry.
Go ahead. No, you can.
So the other thing, I should forget. So the nutrients. So I'm going to put in the links of Brain Wealth, .co.uk. Now, the story behind the nutrients is that after using these Canadian companies, Hardy Nutritionals, after using their nutrients for a good couple of years and really testing them out, I reached out to them and said, look, I want to be able to supply some here for my patients, because the place that I get them from is a bit expensive and it's a bit unreliable as well. So this is where the Brain Wealth came from. So it's the same formulation, it's the same supplement that was used in the research that I read from the book. I'm going to put that here, The Better Brain. I think it's a great book. I think everyone here should read it, by Routledge. I'll put that, Routledge. So it's the same formulation used. So it's not something that I've developed from a lab in China or anything like that. It's the same stuff. It's just got my label on it. So that's where I direct people to get hold of that. The protocol is high, so it's 4 capsules 3 times a day. So that's 12 a day. That's a protocol for ADHD. It's a protocol for depression, anxiety. If you're symptomatic of anything, that's a protocol. I take about 4 to 6 a day myself as a baseline kind of investment in my own brain health, but it's 12 a day protocol for any symptomatic, including ADHD. And between 8 to 10 weeks is the time period you give for people to really see the full benefits. So between 2 and 3 months. So it's not a short-term thing, although some people within a couple of weeks or so can report benefits for sure. But usually it's 8 to 10 weeks is what we give in terms of time scale. And just going back very quickly to the point about genetics and genetic vulnerabilities for ADHD. One of the ways in which high-dose micronutrients have been shown to work, is that if you have certain genetic kind of issues affecting your metabolism, so you might have sluggish methylation, for example, overloading with micronutrients helps overcome some of these genetic deficiencies that impact upon our metabolism, make our metabolism more sluggish. So it's really fascinating that there's a kind of a curve that the more you increase the nutrients, the more you can overcome some of the genetically driven problems in metabolism, in brain metabolism. So yeah, we're just learning about how they work. It's kind of mind-blowing. They also impact the microbiome and change the diversity of the microbiome. So it's really fascinating, and there's a lot more that's going to come out over the coming years. But yes, the books and the nutrients are what I would recommend.
No, that's great. Thank you. And I think it's interesting within micronutrients, because we think a lot of disease begins in mitochondria. We've got a lot of mitochondria in the brain because of the energy, etc. So, whether it's working on that. But the other thing that sort of links in nicely with the next question is we're speaking about the gut-brain axis, but we've also got the brain-heart-gut axis. And that's the vagus nerve, isn't it? And we know that it impacts all 3 areas, and that cardiac health is really commensurate with brain health. So we've got here, is there any evidence of breath work practices, for example, vagal nerve work, or regulating the parasympathetic nervous system, for example, or mindfulness compared to medication? I think I've seen some stuff around this, but I'm going to let you take over as the expert here.
Well, there's certainly evidence looking at the power of meditation and ADHD symptoms, symptom improvement. Now, automatically, the response from ADHD people is that, oh, I can't focus on this or that, and you expect me to be able to meditate. I think it's possible. I think it's possible for anyone. It's like any skill. It's just a bit harder for someone with ADHD, so they just need to be more persistent with it. But certainly having a meditation practice, whether that's a guided meditation, whether that's something like yoga, whether that's something like breath work, these are all, in my book, forms of meditation, can really help improve symptoms. And they work predominantly by reducing the anxiety. Everyone with ADHD is here. So when you bring that down, they can actually have a bit of space to think and to focus. But when the anxiety is so high, it's just much less possible. So they work on addressing the anxiety aspect of ADHD, and there's a lot of evidence there, in fact.
Can I just check? I mean, I've seen some stuff around certain types of meditation that might be more helpful for certain people. So something around binaural beats, and also you know, sort of body scan type of work. Do they carry a particular benefit in being with ADHD? Is that to do with interoception, or I'm not sure.
Yeah. I don't know, actually. I think, again, going on general principles, it's whatever someone resonates with.
Mm-hmm.
So if we're looking at meditative practices in general, being able to give your patients a range of options is really
Brilliant.
important. And I think probably the easiest aspect, so is it binaural beats?
Binaural beats, yeah.
Binaural beats, yeah. I think that gives different frequencies in each of the ears to try and flip into certain brain waves. I think it's flipping out of the theta brain waves and into the more of the beta. So that can be effective. Something like binaural beats is quite passive, right? So you just have to put it on, and you don't have to do anything. To do anything. It's great. The thing that I use that works in that way is neurofeedback.
Yes, I've heard
There's a
that.
certain type of neurofeedback, and I'll pop this in, called neurooptimal neurofeedback, and it's a type of neurofeedback that doesn't require you to look at a screen and to play games and to engage with anything. It actually works without any of that, which is great. So the hardest work is someone coming in and hooking them up to it, and it's kind of a nice soundtrack which helps kind of calm. But the neurofeedback is another way of kind of recreating some of the benefits from meditative practices in a very passive way. It's also a lot more powerful than that. It works in the subconscious space to help overcome blocks. But on a surface level, it is a passive way to help improve things. So that you got the range of more active to more passive. I think the more passive, some of that neurofeedback, it costs more. It costs more than, say, going to yoga or
How do they
doing
compare
some.
with things like flow headsets?
Yeah, I think I'm not too sure about them. Anything that costs a few £100s, I don't think is that effective.
Okay. That's
I think the neurofeedback device that I use, if you were to buy it, probably costs close to £10,000.
wow. Okay.
And I've been using it for about 5 years. Sorry, I've written the wrong thing. I know it works. But these flow, I'm not so sure.
I know there's some emerging evidence around depression, but ADHD is kind of, it's a bit
Yeah,
at the moment.
I remember a few years back, it was at an unrelated event. I met a researcher, some professor in, I think, in Belgium, and he was talking about these EEG devices, which effectively
Mhm.
what these flow devices are. And he said he was testing them in his lab, and he said most of them weren't detecting what they said they would detect, and it kind of put me off. I think, yeah, I'm not so sure about them.
That's very, very helpful. Okay. There's salams from Nuruz, and then we have Zahra. Can patients develop a tolerance to medications and therefore need dose adjustment?
So on the whole, I don't see that as a big issue. Uh, there's two main stimulants that we have in the UK. So we have amphetamine based, which is Elvans, and then we have the methylphenidate based, which is actually, there's about 5, 6 different brands of that, Concerta being one of them, Ritalin XL being another one. What I find is I get a much more consistent response for people on the amphetamine based Elvans. So consistent in the sense of when we're happy with a dose, whether it's 30, 50, 70 milligrams, most people go on to 50 milligrams. Very few people stay on 30, but the level that we get to, it's pretty consistent from there on. I find it's more consistent in terms of response over time than the methylphenidate based ones, which can work really well. But I was finding there was a good kind of maybe 20%, 30% that needed to be changed to Elvans because it just stopped working, which is like disaster when it's fine and you're going on with life and then it just stops. So I don't really see that with Elvans, the amphetamine based one. So on the whole, they work pretty consistently. But I do prefer the Elvans over the methylphenidate based ones for that reason.
I'm quite conscious of time. I think the next two questions we've already addressed, but I'm just going to read them out anyway, in case there's anything you want to add. What are your thoughts about micronutrient supplements versus strategic, healthy or balanced diet, as opposed to impulsive, often unhealthy eating in ADHD?
Yeah, I think you need the nutrients. So most people, so for a few reasons, most people don't eat as well as they may report that they do. They don't eat as well as they can, even if they make changes. But also food is not as nutritious as it was. So we know that the topsoil in the planet is probably about 30% less nutritious, nutrient dense than it was 30 years ago. Okay, so the same food is going to give you less nutrients. And then most of the food that we get, if we're looking at vegetables and things like that, they have kind of pesticides and things that affect, the benefit that we get from them. They all do, even the organic ones, where we just hope and pray that there's a bit less
Yeah, no,
there's
absolutely.
toxic stuff in there. Even organic meat, they get injected with stuff where we just hope and pray that we're paying for something that is injected less.
Injected, yes, yeah. I have a family friend, and she is an agricultural researcher, and she has a PhD. He said for something to be labeled organic, it only needs to be a third organic.
Yeah.
So I think unless we're going to grow our own, we don't know.
Yeah.
Next question. I think you can probably answer this in the chat box, but it's just what particular omega-3 brands and what doses do you recommend?
Yeah.
And then the question after that, is there a role for caffeine as a stimulant?
So I recommend Carlson's. Carlson's omega-3 fatty acids. It's a liquid, and I prefer the liquids because it's much easier to get a higher dose. So we're really looking around 4 grams a day for ADHD, and that's a tablespoon. So Carlson's do natural fish, which is gross, but they also do lemon, which is what I take, and I think it's quite nice. They do orange flavor as well. So they do the flavored ones, which make it a lot more palatable. So that's what I recommend. And that was recommended to me by the Carson's brand by an amazing doctor in America called Sherry Rogers, old school, but she's under the radar. But she is, I think, one of the OGs when it comes to lifestyle medicine. No one's really heard of her, but she's probably the fittest and healthiest 80-year-old that I know.
Amazing.
So yeah, Carlson's. And what was the other one? What was the other
Caffeine can
caffeine. Yeah. I mean,
stimulant.
if you're most people with ADHD are already taking caffeine, right? For obvious reasons, it does work as a stimulant. For some people, it can have the opposite effect. Interesting, make them tired and sleepy. But on the whole, it does help them, and people are on, copious amounts of varying degrees of caffeine over the course of the day. What I find is when people start making the changes, when they start adding the nutrients, doing the exercise, on the medication or not, they automatically have less caffeine. So it's really not a point that I focus too much on. If you're doing more of the other stuff, then you'll need caffeine less. It can work quite well for some people. Some people top it up, top the medication up with caffeine because they need to. And yeah, so, but I think, like with most things, it's not a long-term strategy. Most things iron themselves out over time when you put in the investment. It's the same with drugs, recreational drugs, alcohol. They become less important in people's lives.
Yeah, brilliant. So just an interesting anecdote. My mother-in-law, bless her, she's recently started, so nearly 80. She's recently started just drinking coffee, and I suspected she might be neurodiverse, just not based on a typical presentation. I mean, she's a South Asian lady, and so lots of confounding factors, but lots of gut issues and other issues that you can look at the physical health and almost work backwards, if you can put the picture together. But she said to me, well, I started drinking coffee and my brain just wakes up. And I thought, well, that's a stimulant effect. That's not just caffeine. There is something else going on there. And it's just incredible when you hear somebody's getting that level of effect on maybe just one cup. You think there is something. She says, I can get up, I can walk, and my brain can function. I thought, wow. So that was quite insightful for me.
Yeah, I mean, I think the older we get, things don't work as well. So
Oh,
it can be quite exposing.
quite exposing,
If
yeah.
you've had good coping strategies, which on the whole women do, women have much better coping strategies than
Yeah.
men. And the point that I'll end on is assessing for adult ADHD is a lot more trickier than just going through a checklist, because what you're dealing with people who have found ways to cope in life. Now, the people that cope with maladaptive coping strategies is a bit more obvious: the drug, the drinks, the alcohol, the sex, and all those things. But the people who have developed adaptive coping strategies, like, do you hold that against someone or not? Right. So that's a judgment call that I make. So there's a lot of things that are kind of going on in my mind when I'm talking through someone over trying to find out about their life in an assessment. That's one of the big ones. Now, how much of this is a coping strategy? How much of this is just them? There's a gray area, but you kind of have to make a judgment call based upon everything else. And yeah, it's really interesting. So,
Brilliant. I'm really aware of time. We've taken up more than we had bargained for,
yeah, I do
to
need to go
disappear.
now, I'm afraid. Yeah.
I'm going to say thank you. That was really, really informative and enjoyable. And it's been lovely to reconnect with you and see what amazing stuff you're doing. I think brain and neuroinflammation is one of my favorite areas. And some of you will know that I've got a really interesting neurodiverse family. So my area, I'm probably a bit hyper focused in this area anyway. But thank you. I think we can all embrace the good practice, the micronutrients, omega-3, the exercise, the mindfulness, the meditation, and the good company. And we'd love to have you back at some point. But keep up the great
I'd
stuff.
love to come on. Thank you so much for inviting me. It is certainly a passion of mine. So any opportunity, I'd be more than happy to come back. I'll put my email in the chat if anyone wants to ask or anything or further, or take any of the discussions further. I'll be more than happy to get back to you. I will get back to you eventually. Sometimes it's a bit longer than others, but I'll definitely get back to you. So please feel free to ask me anything outside of this meeting.
Brilliant. Thank you. And I'll just field any questions your way, but thank you again. And Ali, do you want to share details of your private practice, pop them in the chat or send them over to me so I can circulate that? Because I think it's a game changer for the people that can afford to work outside the outside the NHS in a more holistic way.
Yeah, thank you. I've just going to put my website here, and I'm very open to meeting with GP colleagues to think about solutions in primary care. Here, as one of our attendees said, she was a clinical lead, and so I think there's a lot more that can be done in a way that doesn't have to be resource intensive or heavy. And I'm more than happy to devote time with colleagues to find solutions wherever that might be. I think there are things I just can't do by myself in that
No,
way. I think of something amazing, but it's been a long time since I've been anywhere near kind of primary care in that way. And the field everything's changing so quickly. So if there's any appetite to kind of work on something, then I'm certainly up for it.
well, I think there's a huge amount of appetite, but I also think we need to let you go. So
Yeah,
thank you
I'm
very,
late for my
very
next meeting, so
much.
I'm chairing actually. So they're just hopefully waiting
You
for
had
me
better go.
patiently. Yeah. Okay.
You had
Thank
better
you so
go.
much.
Thank you so
Okay.
much. Take
Take care.
care. Bye
Bye bye.
bye.